Hypertensive crisis means increased blood pressure. Crisis means it may be difficulty or danger. Okay. What does the increased blood pressure do? Increased blood pressure can lead to stroke, which is 180/120. Okay. The increased blood pressure, which is 180 to 120, can lead heart to have stroke. Okay. And also the increased blood pressure can damage blood cells, blood vessels. Okay. How does BP increases? That will be seen. Okay. Now we have understood regarding hypertensive crisis. Hypertension means increased BP. Crisis means any difficulty or any danger situation or increase. Why that is called danger situation? Because it is a silent killer. What? High BP is a silent killer, because it can damage the organs and also makes the person go to unconscious and also damage the other organs. Okay. What happens to increase BP? Systole by diastole. Systole means systole means after pumping the blood from these ventricles, means ejecting or forcing the blood to flow from the ventricles to the pulmonary, through the pulmonary arteries to the lungs, and also from the left ventricle through aorta to the body parts. Okay. These ventricles are pushing or ejecting the blood or forcing the blood to flow from the ventricles to the arteries and also to the different parts. Okay. This is called systole. What is diastole? Diastole means filling the chambers with the blood. When the inferior and superior vena cava carries the deoxygenated blood, those deoxygenated blood is then after pumped to the auricles, which right auricle. Okay. After the pulmonary vein carries the oxygenated blood from the lungs, then it flows the oxygenated blood to the left auricle. Okay. These auricles, then after from auricles it flows through the tricuspid and bicuspid. These are bicuspid valve, these are tricuspid valve. Through these valves, the blood is flown through to the ventricles. Okay. These are right ventricles. The blood flow from auricles to the ventricles. This flow is called diastole. The flow from the blood which is carried from ventricles through the pulmonary artery and also aorta is called pushing or ejecting or also forcing the blood to carry through the arteries is called systole. When the blood filled with these chambers is called diastole. Okay. The normal BP is 120/180 and this is the mild or the normal one. Moderate 140/90 and the severity is 180/120. This is the severe and chronic stage which can damage the blood vessels and also the rest of the organs, because there is high force in the blood to pump through the blood vessels. Okay. By the force which is pushed through the valves or through blood vessels, this force will damage the walls of the blood vessels. Okay.